I'm Dr. John McDougall, and one of my great interests is the intestinal tract. I know that may sound a little bit perverse. I even wrote a book, Dr. McDougall's Digestive Tune-Up, which takes you from the lips all the way to the other end of the gastrointestinal tract. As far as the end of the gastrointestinal tract, we can reach that with a tube, and there's a lot of trouble in that part of the intestinal tract. It's called the large intestine. Why? Well, because the food is stored there for a long time, the remnants of the food. And you grow also an awful lot of bacteria. There are like 400 different species of bacteria in your intestinal tract, at least 400 different species. And the concentration is huge, like 4 trillion bacteria per cc of feces. So you have the influence of all kinds of bacteria that grow there. The materials stay in the intestinal tract a long time. And because of these factors all working together, what happens is if you eat the Western diet, you grow bacteria and you have contents in the large intestine that are carcinogenic. They cause cancer by irritating, by damaging, by toxicity to the intestinal wall. And what it starts out with is swellings on the intestinal lining. They're called polyps. They're just proliferations of smooth muscle cells. And these polyps, they grow and grow and grow. And eventually, on average, when they get to be 15 years in their development, they start to turn into colon cancer. And it takes another 15 years to kill you. So you're dealing with if you have a test today and you get a polyp that's destined to turn into cancer, you probably won't benefit for 20 or 30 years from finding that particular polyp. But anyway, the general recommendation is to have a general recommendation in the United States is to have a colonoscopy. How often? Maybe every couple of years. And when do you start doing this? Well, depends upon who's recommended it, but as early as 40 years old, but usually 50 or 60 years old is the age when you start having your first colonoscopy. If it's clear, you should be free of any further examinations. If you're going to go through a colonoscopy, I realize a colonoscopy is a pretty big deal. They take a 6 to 8 foot tube, they stick it up your butt, have to go through all kinds of torturous turns. And as a result, perforations occur in the large intestine, which can be fatal. There was one study done on Kaiser patients. They looked at people who had colonoscopies done that also had polyps removed, and there was a 7% serious complication rate. So this is nothing minor to think about. You have to take a sedation or an anesthesia. And by the way, it costs you $3,000 on average to have one of these things done. Well, what's recommended by the U.S. Service Preventive Task Force is that you have a bowel exam of one kind or another done. And they could be examining the stool for blood or for biologic materials. Or it could be a visualization with a scope, such as a sigmoid scope or a colonoscope, or a virtual examination with a CAT scan, where they don't really enter the body at all, but they can pick up polyps. And what they tell you, the U.S. Preventative Services Task Force, they tell you that these recommendations are not listed in a preferred order. It's because it doesn't matter which test you have in terms of reducing your risk of dying of colon cancer. Okay, of dying of colon cancer. So I would say start out with the safe and cheap one. Checking your stool for blood costs you less than $40 to do a full spectrum of tests. Never any harm, absolutely side effect free. I would start there. I wouldn't go for a colonoscopy. In fact, I don't recommend colonoscopies as far as screening for anybody. What I recommend is that you have one sigmoid exam around age 60 or check your stool for blood or genetic material. Never a colonoscopy. Why don't I recommend that? Because the overall risk of dying is the same, because this kind of testing kills. And so if you look at the overall mortality, you're taking the effect people who die from anesthesia, people who die from perforations, bleeding, etc. You take and you add that up to the lives saved by removing polyps early, you end up with a wash. In other words, there's no reduction in overall risk of death. It's just that you have less chance of dying of colon cancer, but you have more chance of dying of perforation. Well, are my recommendations solid? Well, consider the fact that in the year 2019, the Canadian Preventative Task Force, they recommended that Canadian citizens do not get colonoscopy exams. They'd recommended before that, but their recommendations came out. They said no more colonoscopies done on Canadian citizens, which matched what every country that I'm aware of in Europe says to their citizens. Do not get a colonoscopy for prevention of dying of colon cancer, not overall risk of dying, but dying of colon cancer. So my recommendation is very, very strongly to eat the diet that prevents polyps and colon cancer, which is a starch-based diet with fruits and vegetables, no animal products, no added oils. That's what I recommend as far as really, if you want to be serious about living long and avoiding all kinds of diseases, including colon cancer, that's what you eat. As far as early detection goes, I do recommend that you have an examination of the bowel between the ages of 60 and 75 years old. After 75, you're too old to really reap any benefits. So between ages 60 and 75, that you have a sigmoid exam and or checking your stool for blood or genetic material. That's it. And then I fit in with the Canadian Task Force for Preventive Medicine, their recommendation in virtually all European countries. And the only thing we miss out is the financially driven country of the United States of America, which thinks of business first and people second, too often. I'm Dr. John McDougall. Thank you for asking that question.